we always hear that the mouth is the mirror of general health. Can we, by any chance, uh, see some early signs and symptoms of COVID in the oral cavity itself?
Sure. I mean, we are all now in a second phase of this COVID, and most of us have had some kind of experience with this devastating pandemic, which has ravaged every part of the world. And now we are seeing such a huge kind of surge during the second wave. A lot of things have evolved, and we are understanding COVID very, very deeply. We are trying to understand, although this virus has been mutating itself. I mean, coronavirus is notorious for mutations. And the new variants which are happening is giving different kinds of symptoms than what we had seen last year. So I think a lot of oral findings are there in this new surge which we are seeing. One of the most common things which we are seeing is the fact that you are getting a lot of gingival inflammation, a lot of erythema. That means that redness or a rash kind of thing which is coming inside the mouth. And of course, you still have the classic kind of symptoms of fever, cough, and loss of smell and loss of taste. In fact, many a times people who have been tested as negative with RT-PCR test, which is like the gold standard which has been done, the moment they have basically loss of taste or smell, that is actually an indicator that there is a COVID infection. So this is something which we are understanding. And that's why today a lot of CT chest is being done as the gold standard to understand how much of basically COVID infection is affecting us. So you're seeing a lot of redness or rash in the mouth, bleeding from the gums, which of course is very, very common even otherwise also. But during COVID time, there is an exaggeration of this bleeding and a bad odor which emits from the oral cavity. Sometimes you see some pus kind of thing coming at the back of the throat. All these are common symptoms which we are seeing in this new surge of infection.
Wave, it is no more the RT-PCR, which is the gold standard. So you're looking at many more signs and symptoms, is what you're saying.
Absolutely, absolutely. Because this disease is very, very notorious, and every day we are seeing a different variant, and it is becoming much more aggressive. And that's the reason why we need to be very, very alert with the kind of signs and symptoms. Sometimes it could be a simple rash on the face, a rash inside the mouth, a redness, or an ulcer which is not healing. This itself could be an initial symptom of COVID before you even get fever or throat infection or dry cough. Mouth symptoms are probably seen much earlier than even the classic symptoms of COVID infection.